Bonjour, my name is Stacy. Indigenous Hawes. I'm from Wabsmung First Nation. So I've been nursing for about 3 years. I graduated from Lakehead in 2016 and I worked in the ICU for a little bit, and then I've always been passionate about community health, and so after getting some hospital experience, I wanted to take my career back to community, and so I've been working at WinHack now since August, and I've been really enjoying it, and I'm happy to be out in the communities and working with the organization. As a nurse, we take a holistic approach. So we looked at everything from the mind, the body, and the spirit. I sort of like to look at most illnesses in that way as well. So with diabetes, there's 3 different types. There's type 1 diabetes, type 2, and a gestational diabetes. So I'll just kind of give you a brief overview of what each of those are. Type 1 diabetes is basically where your pancreas isn't producing enough insulin. And I'll just tell you about insulin. So what insulin is it helps carry energy to your cells. In type 1, like I was saying, your pancreas isn't producing enough insulin, so you're not getting enough energy to those cells. And so that's usually happens from birth. Type 2 is where you have resistance. So your pancreas might produce a little bit of insulin still, but that insulin has become resistant and therefore isn't bringing energy to the cells, and or it might not be working as efficiently. You may need supplemental, maybe medication or external insulin, so maybe using an insulin pen. And then gestational diabetes is where it happens in pregnancy. During pregnancy, we have lots of hormones, and normally our pancreas, like I said, produces the insulin. But with all the hormones and stuff going on, it can become overwhelmed and might not be able to keep up with what's going on. And so we get diabetes that way. It might just happen during the pregnancy, and your healthcare provider would keep a close eye on you and help you monitor your sugars. But what can happen as well is after you've given birth and all that, you might, the gestational diabetes could develop into type 2 diabetes, or so you could end up having diabetes after. So we're very cautious with our women during pregnancy and their blood glucose. So that's kind of just an overview of all the different types. I could go into a lot more detail, but that's just to give you guys a basic picture as we continue with this discussion. We get these large glucose or sugar molecules floating around in our bloodstreams, and the insulin can't go and grab the sugar and bring it to where it needs to go to give you energy. You get all these molecules of glucose floating around, and what happens is they can get into small arterioles or small vessels, so like your toes, your kidneys, and the backs of your eyes. And what can happen there is if we don't regulate it, it can actually cause damage because they're so big that they block off the blood flow to those areas and can cause damage to the eyes, to the kidneys, and to your vessels. So those can lead to complications such as kidney disease or eye diseases or vision loss, So those are some things to be mindful of when managing your diabetes. These things can develop over time. So not monitoring your sugars, or if they're running high all the time, those can lead to these progressive changes. And so what happens is over time, you might notice you have some blurry vision, or you might be getting some nerve damage, because that can also happen with diabetes if it's untreated for a long time. So you might notice some tingling in your feet or in your legs, and those are signs that the sugar is damaging the blood vessels and the nerves, and those complications arise. Just because you have diabetes doesn't mean that you can't live a meaningful life. In fact, I know a lot of people who live with diabetes and they have great lives and good quality of life. It doesn't mean that you can't go out with your family and have a nice meal at a restaurant. It just means that you have to take extra precaution and monitor your food choices. Food and exercise are a big part of managing diabetes, and of course, in addition to managing your sugars. Even just a 30-minute walk a day can make a huge impact. So I always like to tell my diabetic clients that small changes could lead to big results. So we can apply that to a lot of things in our lives, but even just, say you're just starting fresh, or you haven't been, managing your healthcare for a couple months, and you're like, oh, I want to, hop back on and kind of see where you can go. And so I just say, try making small changes. So say you like to put 2 sugar in your coffee a day, maybe try changing it to like a sweetener instead of sugar, or even going for a small walk each day, or even 3 times a day. For food choices, maybe picking a whole grain over like a white bread or something. Reducing the amount of sugar in your overall diet, or drinking less pop, or having sugar-free beverages, or even choosing water is a really good way to make a small change that can create a big impact on your health. It is good to monitor your sugars, because when you look at the number, you can interpret how you're feeling with those numbers as well. So it's really important, especially if you are making changes, to keep an eye on those sugars, because you don't want them to go really high, and on that note, you also don't want them to go really low. So it's important to test your blood sugars every day, up to 3 times per day, unless otherwise instructed by your healthcare provider. So we like to test sugars each day because they fluctuate and they change throughout different times of the day, and whatever you've been eating, it's always good to test to see how your body's responding or reacting to that. There's a main way to test, which is using your glucose monitor. So this is the one that we have here. There's many different monitors on the market, and they come in all different shapes and sizes. And so your healthcare provider will normally set you up with one of these and show you how to use it. To test your sugars, you would just need a monitor, the glucose strips, and then something to prick your finger, and that normally comes with the monitor. And so from there, you would wash your hands well, especially if you had been eating fruit or something. That can leave sugar on the fingers, which could alter your number. So it's always good to make sure your hands are clean and that you've washed them. And then you would simply prick your finger, and then whatever blood has come out, you would put it up to the monitor, and it would take a few seconds to calculate that, and then it'll give you a number. And so we like to say between 4 to 7 before meals, and then 5 to 10 after meals are good ranges of numbers to be in for diabetics. And then there's also another test that we do, and that's normally taken from venipuncture, and that's called your hemoglobin A1C. So we normally like our diabetics to have this number checked every 3 months. So what this number is it basically gives us an average of your blood sugars over 3 months. So this is a good marker just to keep an eye on if we've made any changes or you've made any dietary changes. It lets us know that these changes have been effective. So we like to do those tests as well. It's really important to make sure that you are getting your blood work done. So like I said, it's good to get it done every 3 months unless otherwise instructed by your healthcare provider. So I encourage my patients to come and get that done, and then we just discuss your lab work and see if there's any improvements that we can make, or maybe you have made improvements and we can see how those have made a change in your lab results. Definitely managing your blood sugars can reduce your risks of developing any complications. So monitoring those numbers, staying within a specific range. So like I mentioned those numbers earlier, those are definitely the numbers that you want to maintain your blood sugars in to reduce your risks of developing any complications. Certainly taking your medications, attending your regular appointments, making sure that you're following your dietary plans if you have one in place, and simply just avoiding excessive amounts of sugar, choosing sweetened free beverages. So there's lots of really good flavored waters on the markets these days, so those are a really good option too. Or there's actually really a lot of good herbal teas, but just make sure that you're discussing that with your practitioner to make sure that there's no interactions with your medications. But for the most part, those are good ways to help manage that and to reduce your risk of developing any complications associated with your diabetes. Yeah, I do see it being more prevalent among First Nations people. In the language or in the wording of healthcare professionals, we do use modifiable. And what that term means is that something you can change, it's within your control. And then we also have our non-modifiable health risk factors. And so what that comes down to is we look at ethnicity as one of them. It could be your gender, it could be your age. So those are all things we can't change. And unfortunately, within First Nations peoples, that is one of the ethnic backgrounds where diabetes is more prevalent, along with Spanish, Black people, African American, and Asian people of Asian descent. So That's one thing we can't change. However, I always like to tell them that there are things that we can change, and those are the modifiable risk factors. So making sure we're avoiding smoking, making sure we're exercising regularly, maintaining a healthy weight, making good food choices. Those are all things that are within our control. And so if we can focus on making those changes, certainly those are positive things we can do to have an overall impact on our health. I do like to motivate my clients living with diabetes to sort of think about that and focus more on that, the things that we can change and that are in our control, instead of focusing on things that we can't change. So if I have a client who's come in and they've recently been told that they have elevated blood sugars, this is a really good opportunity to kind of make some changes. I just kind of discuss what the difference is in their numbers for their sugars, and just talking mostly about diet and exercise, because early onset diabetes are a good time or a good place. I mean, there's never a time when it's not good to make changes, but in this case, focusing on exercise and diet is really important. So looking at what you're eating, making maybe a food journal, or even if you have a smartphone, calculate or inputting the food that you're eating on there and just keeping an eye on that and how much sugar you're having daily. So cutting out small amounts of sugar. If you notice, like maybe you've been told you have high blood sugar, say you go out, you're in Winnipeg, you are there with your family for the weekend, and you've been going out for dinner a few times, and you're drinking lots of pop, or you've been having lots of, some tea with lots of milk and sugar, and you notice that you've been peeing a lot and you've been thirsty, and you're like, oh, this is unusual for me. So naturally you go to the doctor to figure out what's going on, and lo and behold, you find yourself in a merge there and your sugars are elevated, and you're thinking, oh, well, how did this happen? Well, they tell you that maybe you have diabetes, and they start you on a medication there. So from there, you'd follow up with your healthcare provider, and we would work with you to make some changes. So we'd kind of see what happened. Maybe you did tell us that you've been drinking lots of pop that weekend and stuff. So right away we would say, stop drinking so much pop, try and cut it out. We would do the hemoglobin A1C, which I was talking to you about earlier, and that would kind of just give us a number. We'd get you in with a practitioner to talk about maybe some potential medications to start you on, but we'd really look at focusing on diet and exercise to help reduce those sugars in the beginning. And if you were started on a medication, just kind of seeing if that's been effective for you and what your sugars are like, and getting you to take your sugars before your meals and after your meals, just to see how your insulin is responding to the food, and if you do in fact require something to help with that. One of the big things we like to get people to start doing is, of course, if you've been started on a medication, it's important to be taking your medication as prescribed. And the second most important thing is to make sure you're monitoring your blood sugars. So the monitoring your blood sugars and logging them is going to give us information to see where we need to make some changes, or if things are going great. But having those numbers for us to review with you is really important. It's also really important for you to understand how you're feeling during those times when your sugars might be high, and recognizing those feelings. And then the third thing is, like I was saying earlier, is making sure you're getting your annual or your Q 3-month blood work checkup and checking with your practitioners. And just being mindful to make a phone call if you do have some questions or you need some education. So making sure you're making those appointments with your dietitian. And the biggest thing too, I should mention, is foot care. Having your foot care assessed is really important. Sometimes when we have diabetes, a complication could be venous insufficiency, which means like sometimes with the blood flow, it's not circulating as well, just with those large sugar molecules. So having your foot care completed once a month, and even yourself, what you can do at home is taking a mirror and just checking your feet, because sometimes if you do get the numbness and tingling like I was talking about earlier, if you have a little rock or something in your shoe, you might not know, and that can cause damage to your feet. So that's really important. And making sure you have proper footwear, that's another important thing. So when you see your foot care nurse, she might look over your footwear with you and make recommendations. She can even make referrals to someone if you need orthotics made, custom for your feet. So those are all important things to make sure you're doing when you're living with diabetes. Don't be too hard on yourself. No one's perfect. We're all human. We all slip up once in a while, but if we can focus on small changes every day, they add up to big results. So I just want you guys all to know that. Just even checking your sugars, reducing the amount of sugar you're adding into your meals can make huge changes. So as we know, among First Nations people, type 2 diabetes is higher, the rates are higher. So some things we can do is we can recognize that, and as a community we can acknowledge that and work together to try and overcome this. We have the tools, we have the education. I believe that we can prevent diabetes and overcome this epidemic of it within our communities. As First Nations people, in our history, we've overcome a lot of things. And this can be another thing that we can overcome. You can live a meaningful life even with a diagnosis of diabetes, and we can prevent diabetes in our future children and the next generations to come. And I just want to leave you all with that message, and let's start working together and overcome this.